Welcome to the Coronavirus Diaries with me, Vassilis. Here today with Oleg Maslov, an old colleague of mine and now communication consultant, who is in Seattle, Washington, States. Hello, Oleg.
Hey, Vasilis, really nice to see you.
Good to have you on the show. Welcome.
Thank you.
So let's start with how's the situation now in the United States, as far as you know, about the coronavirus? What's happening? Give us your thoughts.
Well, I think people are scared. In general, this is something that most people have, at least my age, have never seen in their lifetimes. They've never lived through something, that impacts society on such a pervasive level. In the beginning of this crisis, there was a big run on. We've all seen the toilet paper memes. There was no toilet paper in stores for a little bit, and they started rationing toilet paper in grocery stores and in other places. There's a lot of uncertainty with the financial markets right now. How much of the financial markets are collapsing as a result of the coronavirus, and if there were other factors like this oil price war that's going on, and those two things have kind of really freaked people out in a way.
I want to talk now a little bit with Oleg, the journalist that I used to know as well. So, at the beginning, President Trump was dealing with this as if there's nothing wrong, no problem, we are totally secured. This is something that's happening in China and we don't care. Then afterwards, he suddenly made this big speech with so many people from private and public sector about fighting the virus while having handshakes with everybody live on camera and following every protocol. Then he said it's just a bad flu, but now he changed again. Now, how do you comment on this, and how do you feel that this is the leader right now?
I, it's hard for me to say. I know that Trump's approval rating has gone higher than it's ever been. His approval rating has reached record numbers. So in general, the American people seem to approve of what he's doing. Have the steps that are taken, have they been drastic? Has it been a rapid turnaround? Yes, it has, for sure. That definitely contributes to this general feeling of uncertainty that I was talking about. People aren't sure what's going to happen tomorrow. They're not sure. This stay-at-home order's already been extended once. Trump was saying, we're going to have the economy back by Easter, and now it's been extended for 3 weeks until April 30th. So that really contributes to this general sense of we just don't know what's going to happen. And he certainly isn't helping in that regard by changing the message frequently. But I think that you have to cut leaders and executives a little bit of slack in these kind of situations, especially people who don't have a background in virology, who are getting feedback, from all these experts and different stakeholders. And of course, Trump is also very sensitive to the media. So that complicates the situation even more. There are record numbers of unemployment that were just announced recently, and I'm sure that there are a lot of people who are impacted very significantly. And I feel really lucky that that's not the case for me.
I mean, you are a young person, a young professional. How do you feel about the measures that the state and federal government are taking for the economy to help young people right now in a difficulty, to help businesses, to help unemployed people? I mean, you said earlier that you feel a little bit of an uncertainty, but do you feel that they are economically trying to help?
So this is a very complex issue. I think the stimulus bill is unprecedented. The amount of money that the government is getting ready to inject into the economy, not just the stimulus for businesses, but also what the Federal Reserve is going to be doing, for primary dealers and big Wall Street players. Uh, I have mixed feelings about it, to be honest. I think that it's absolutely nobody's fault, like Trump says, that this pandemic's forced them to stay at home and basically shut down huge sectors of the economy. But at the same time, I think that playing loose and fast with money is may lead to some troubles down the road that we aren't able to foresee quite yet. But I see all around me and my family and friends how people are going into crisis mode. People are tapping their savings. People are seeking state assistance, and it's only a matter of time until this passes. But then we have to deal with the economic fallout.
You said that your mother and a lot of the members of your family are in and out of hospitals these days. For me, it's already very brave because I doubt it's going to the park or the supermarket, to be honest. Do you feel that you are unfortunate in the United States that you don't have a public healthcare system in place, and that this could be a major factor right now in a pandemic? Because we used to live in Berlin
Yeah.
at the same time. Would you feel more comfortable, you as a person, living in a public healthcare system, and maybe your family and your parents that are older, more affected perhaps? I'm not being ageist here. This is what's happening with the virus, unfortunately. In a system like Canada or like Germany or like Belgium, or you're feeling more secure in a system like the one of the United States, where the private sector is more important?
And personally, I really like the European, especially the German healthcare system, quite a bit more than the American healthcare system. I have a philosophical problem with a for-profit healthcare system. Well, of course, I understand there's a thin line between the drive for innovation and finding new treatments and providing care to a large swath of the population. So it's a balancing act for sure. And I think, in the United States, my personal opinion, the scales are tipped in the wrong direction. There's too much of a profit motive at play. And of course, there are good sides to this. Medical professionals are very well paid in the United States. Whereas in places with socialized healthcare systems, the salaries are significantly lower. And of course, the pace of innovation in the United States for producing new treatments and drugs and different things is faster because there's more of an incentive for companies to do that. That being said, when things like this roll around, and in the back of your head, you keep thinking, are hospitals more worried about the bottom line, or are they worried about treating as many people as possible? And sure, yeah, you've got the government stepping in and helping hospitals basically coordinate a response and help as many people as possible. But will it be enough?
Now that even if your family is close by, you cannot go and see them, or maybe it could be a threat even for your mom to come visit you,
Yeah.
because she's in and out of hospitals. And with the fear that even going to the park, you can, I don't know, see somebody and without social distancing, because they're just running in the park, you can get the virus. How do you feel about this? Are you positive? Are you that this is just a little anecdote that we will be telling in the future to our grandchildren, or are you seriously scared and seriously worried that it's going to change our lives forever somehow?
I'm not worried about my own health. I'm pretty healthy as it is, and I'm in the demographic that probably wouldn't suffer too much. That being said, of course, I'm still practicing social distancing. I don't want to get sick, but I wouldn't say that I'm afraid of the virus. I'm more afraid of transmitting it to people I love, like my grandparents or parents. That's what really keeps me up at night. And I think, I mean, people die of the flu every year, and this is a similar type of contagion, you could say. And the same people that are at risk for COVID are the same people who are at risk for serious complications from the flu that comes every year. And I think, at least I hope, that our society, not just in America but in the world, is going to approach uh, maybe even flu situations in a different way. And we'll think, I think our psyche, our global psyche as humanity, as a people, as mankind, is going to be altered for sure. We're going to be thinking more in terms of germs, in terms of fomites and particles that travel through the air, and how our interactions can actually be very contagious. I think that when you have such widespread customs like handshaking and hugging, maybe some of those things are going to be rethought, which is unfortunate. But that's the kind of world we live in, and I think that our behavior has to reflect the reality of the situation. Is that, by doing these kinds of things, we put ourselves and our loved ones at risk. And I think that we might have to have like a conscious shift about how we interact with each other on that very basic level because of this.
I think I was thinking as well, and actually, when I was in Portland a month ago, I was saying, yeah, it is a little bit like the flu. What we don't know yet, and as you said before about the doctors and about world leaders, what we don't know yet is, let's say that you get it, how will that affect in the long term? Like, let's say you get it, but you're asymptomatic today, but what happens in 2 or 3 years with your lungs, we don't know. This is something that still freaks me out. This is one of the reasons why I would prefer, even if I am the healthiest person, not to get it, because I don't know what will how will this affect me in the future as well, except for my loved ones, and I'm a
Of
little bit
course.
scared about that.
I'm fairly confident that that this curve is going to be more or less flattened by June. At least I really hope so. And right now, a lot of people are revisiting the kind of powers that governments have in times of crisis, especially being able to, deploy military personnel onto the streets, create checkpoints, lock people down in their homes. That in a certain portion of the United States population has triggered something very powerful. And it makes a lot of sense why these kind of powers exist, because drastic times call for drastic measures. But at the same time, um, we really need to take another look at the kind of powers that our government is able to possess during these times. If the crisis were to get worse, would we allow our military personnel to oversee forced vaccinations, for example? Is that something that we can stomach? Is that, like, what are the standards? There's a thin line between testing for human trials and the effects of a vaccine on the human system after years versus the immediate need to vaccinate large portions of the population to contain a raging epidemic. What are the balances between state power and um, the real need to contain something? I really hope that journalists such as yourself and communications people will start asking these kind of questions and open this up for the public debate. What is the limits? What are the limits of the role of government, and how should we safeguard our own freedoms in times like these?
Exactly what I was about to say as well. In Hungary already, the parliament does not exist anymore because of the epidemic. There's a lot of criticism about this, but it's exactly on the point that you said as well. A month ago, we wouldn't think, even in Brussels, that we wouldn't be allowed to even go for a coffee, but now we
Yeah.
are not. So, as many people have said, this will be something that's unfortunately, I'm afraid.
Yeah.
Um, so Oleg, thank you very much for this interview. It was really an
Oh,
honor for me. Thank you for coming to the Coronavirus Diaries.
thank
And
you so much, Vasilius. I had a real pleasure. I hope you and your family stay safe, and that you guys stay healthy during this really uncertain period. And I look forward to chatting with you once the curve has been flattened.
all right, stay safe and healthy.
Thank you.